I was in 6th grade when all of a sudden, it seemed, I couldn't breathe anymore. I was coughing all of the time and I couldn't dance the way I wanted to. Dancing has always been my passion, and every time I came off stage, I collapsed.
I always felt weaker than other kids. And then, yeah, there was at the pool, you know, I didn't want to take my shirt off. You know, I had this big dent in my chest. It makes me look different. And I'm afraid of being teased, and I look weaker because of it. As a teenage male, one thing you don't want to be perceived as is weak. You know, that's something that can kind of set your self-esteem off a little bit.
The symptoms just got worse and worse, and I had such a hard time physically and mentally dealing with that, because I wanted to do so much. I wanted to go outside and play with the kids. I wanted to spend time with the family, and some days I was just down and couldn't do anything.
Pectus excavatum is a depression in the chest that develops sometimes as early as infancy, but oftentimes will become more apparent in teenagers and adolescents during a growth spurt.
The most common symptoms that we see with Pectus excavatum are shortness of breath and chest pain. The shortness of breath related to a limitation of the ability of the chest wall to expand normally, and the chest pain coming from irritation of the area where the ribs join the sternum.
Pectus excavatum doesn't always need to be repaired, but in those patients who are interested in undergoing treatment for it, really the only options are surgical.
There are a number of reasons that people come to see us for pectus. Probably the most common is the way that the chest looks and how much that bothers a young developing teenager. We take that very seriously and consider it a very important and significant reason to look into repairing the pectus.
About 85 to 90% of patients are good candidates for a Nuss procedure, and that's what we do the most of.
We make a small incision between the ribs. We tunnel a bent, curved bar that's made specially for that patient through the chest, under the ribs, in front of the heart, and out the other side. And when we place the bar, it's with the bent portion facing backwards. We flip it over and it elevates the chest.
After the surgery, what most patients are immediately struck by is that their chest is completely fixed. They see an immediate 100% result and a 100% correction.
They're going to have some pain. Fortunately, you know, we have ways of dealing with pain. You know, we can't eliminate it, but we can control it.
During the surgery, we use a very long-acting local anesthetic that provides pain relief in the chest for anywhere between 2 and 3 days after surgery. During those first few days after surgery, we use a combination of several different intravenous medications and oral medications to control the remainder of the pain, and it works extremely well. Most patients are in the hospital between 4 and 5 days, and then go home after that on several weeks of oral pain medication.
After a Nuss procedure, when these kids wake up in the recovery room and go back up to their hospital room, their parents are usually taking pictures with their iPhones and showing the kids and stuff, and they can't believe how quickly the chest wall looks better and how good it really does look.
I had been on Advair, the highest dose, which is an inhaled steroid for asthma, and I was on the highest dose of Prevacid for acid reflux disease, and I was on that dose twice a day before the procedure. And now that I've had the surgery, I'm on absolutely nothing. I don't need it anymore because I'm healthy.
The surgery was about 4 months ago, and since then I've had a lot better blood flow, because I used to have pulling in my lower extremities. I've had just a total, absolute turnaround. If anything, I've been having to have everybody help me calm down because I'm so ecstatic about how great I feel.
It's been great since I've had it. I feel great about the way my chest looks. I feel more confident in social settings. Emotionally, I feel better about myself. The procedure really, really helped me grow as a person, and it helped correct a lot of the problems that I had, both physical and emotional.
One of the big advantages of coming to the Cleveland Clinic for treatment of Pectus Excavatum is the depth of experience across the entire institution.
That's one thing that I think differentiates us from a lot of programs, not just one person doing the repairs of Pectus Excavatum for patients. It's really our whole team that does it.
The kind of environment we practice in is experience rich, and I think that helps when we're able to offer that to patients.
We've had scores of patients that have literally been transformed not only in the way that they look, but in the way that they feel about themselves. And to see that unfold as a surgeon is very satisfying and really wonderful to watch and be part of.